the most precious gift bestowed to us. We see, enjoy, and get things into our mind through eyes. We feel ecstatic, perceiving sights of pleasant dawn's light. Panoramic views of the nature, with vibrant colors, and above all, the human inventions, making the world more living-like. Other than our different sensing organs, we gain 80% knowledge through our eyes. Eyes, the most expressive part of human body, are also admired for their beauty and worth in number of sayings and songs. But what if this vital source of visual information gets impaired due to some sort of ailment, as eyes are also the most sensitive organs? The life becomes gloomy, deficient, and insignificant. At such depressing stage in life come forward the able experts who set things right to prevent distortion in vision. One among them is a legendary name, Dr. Bharat Prasad Kashyap, who was determined to serve the society and to fight against ever-escalating problems of eye impairment. Way back in 1966, he established an eye clinic with the then available technologies of medical science and the pious feelings of a socially committed eye care specialist. Today, the same small eye care center has turned into a super specialty, Kashyap Memorial Eye Hospital. The credit for transformation of a small eye clinic to all-new super specialty Kashyap Memorial Eye Hospital goes to Dr. Birendra Prasad Kashyap and Dr. Bharati Kashyap, the son and daughter-in-law of late Dr. Bharat Prasad Kashyap. Late Dr. Bharat Prasad Kashyap and Dr. Vinod Shankar Gupta, father of Dr. Bharati. Both Dr. Bharat Prasad and Dr. B.S. Gupta were toddlers under Dr. Bharati's grandfather, Dr. T.B. Gupta. Following the line is the fourth generation, the young Vibhuti Kashyap, who has decided to become eye care specialist to serve the society. Yes, the unstoppable stream of perfection continues to flow in Kashyap Memorial Eye Hospital. The hospital dedicated to quality eye care makes the best treatment available even for the severest complication of eye impairment. The hospital, having the finest breed of competent doctors, provides treatments of cataract, C3R Vega laser, glaucoma, oculoplasty and squint, vitreoretina service and even pediatric ophthalmology. All the 6 operation theatres of the hospital are fully equipped with individual anesthetic equipment including cardiac monitors and emergency crash cart. Ranchi-based Kashyap Memorial Eye Hospital is regarded as the safest and the best in the field of eye care, not only in Jharkhand and the states of the eastern region, but in the entire India. A number of surgical, investigative and medical procedures earlier out of the reach for the natives are now available in the hospital. This helped in gaining added faith and patronage of patients. Also, the doctors of Kashyap Memorial Eye Hospital became motivated to carry on and push the limits of excellence and community services. The cataract and the IOL department caters phaco emulsification technique under standard microscopes like Moller-Weddell and Leica. The cornea clinic provides the best treatment with diagnosis and management of all corneal diseases. C3R cross-linking treatment is one of the latest advancements in ophthalmology. Kashyap Memorial Eye Hospital is the first and the only institute not only in Jharkhand but in the nearby states to offer this revolutionary treatment, which is the only treatment that permanently halts the progression of the dreaded keratoconus disease. In the entire region of eastern, western and northern India, Kashyap Memorial Eye Hospital is the only eye super speciality hospital that has got NABH accreditation, which is handed over to only those hospitals that follow certain international standards in terms of medical care.
Since 1966, even as an eye clinic, the hospital services were invincibly number one. But the success of unbroken reign of the hospital is largely due to rapid adaptation of new technological advancements and fast acquisition of accreditation structure of NABH developed by Quality Council of India. The hospital got the most coveted NABH accreditation in February 2009, and Kashyap Memorial Eye Hospital became the first NABH accredited eye hospital in whole northern India, eastern India and western India.
इसलिए हम लोगों ने देश के और विदेश के विभिन्न भागों में जाकर के जो नामी गिरामी आँख के जो अस्पताल हैं उनका हम लोगों ने अध्ययन किया, वहाँ जाकर देखा और वापस आकर के हमने ये देखा कि हमारे झारखंड वासियों को किस तरह की अस्पताल की और सेवाओं की जरूरत है।
NABH for hospital standards involves compliance with 527 objective elements that are spread across 10 chapters in 2 sections: patient-centered standards and healthcare organization management standards. The former includes continuity of care, patients' rights and education, care of patients, management of medications, and hospital infection control. The healthcare organization management standards comprise continuous quality improvement, facility management and safety, human resource management, responsibility of management, and information management systems. The patient information includes spreading awareness through display boards, counselors, and information brochures at OBD and OT area. This helps patients with continuity of care, patients' empowerment in decision building, availability of information, uniform and transparent billing. The hospital has also got the ISO 9001-2008 accreditation that is particular about infrastructure changes like fire exits, elevators and calibration of equipment. Following the lines of NABH, the hospital has designated and qualified infection control staff. Control and prevention of infections is ensured through unique of its kind, the high-tech swab and culture technique. Hand washing facilities in all patient care areas are accessible to healthcare providers. Adequate gloves, masks, soaps and disinfectants are available and used correctly. As per the NABH guidelines, rights of the patient and family members are well respected in terms of the personal dignity and privacy during examination, procedures and treatment. At every stage of treatment, right from patient's entry at reception to the final treatment, everywhere they are well informed about the procedure and their consent is taken at every step of treatment. Before admission, before anesthesia, before surgery and any invasive or high-risk procedures. Consent is also taken even for all general checkups and at the time of registration. The guidelines are also set for the services such as pathology and biomedical waste which are outsourced. Laboratory results are available within a defined time frame and critical results are intimated immediately to the concerned personnel. As per NABH, the pre-surgery OT checklist has various elements comprising patient verification, eye, lens, type of surgery which has to be signed by the operating surgeon with date, time, name and signature. sterilization of various instruments kept in each tray, swabs and linens and gowns, and tubes of different phaco machines and vitrectomy machines kept in each drum is documented. For every patient, everything comes fresh, whether it's the instrument set, irrigating solution, viscoelastic, trolley preparation or needle for administering a block. All patients for anesthesia have a pre-anesthesia assessment by a qualified individual. During anesthesia, monitoring includes regular and periodic recording of heart rate, cardiac rhythm, respiratory rate, blood pressure, oxygen saturation, airway security and level of anesthesia. For emergency situations, CPR practice is followed by competent doctors, well-trained nursing attendants and the ambulance driver. The checklist for ambulance services is scrutinized and monitored every day. NABH has set protocols to handle emergency within hospital premises, including fire, earthquake and cardiopulmonary resuscitation. The organization confirms safety of patients, staff and visitors. For the same, the hospital authorities maintain the safe compound, safe water and safe electricity. For fire hazards, 100% compliance to the State Fire Authority are maintained with internal and external smoke detectors, sprinklers, hose pipes in all floors, all types of extinguishers, fire alarms and 200,000 gallon water available at all the times. There are designated individuals responsible for the maintenance of all the facilities. To maintain safety and security, we have surveillance cameras all around. NABH is very strong on management of drugs, standardized protocols in pharmacy, which details to avoid confusion on look-alike or sound-alike medications. Our pharmacy is up to date with required drugs from drug formulary. Proper storage and labeling of medication is maintained. Here, adverse drug events, if any, are put into records. No drug can be prescribed without its entry in hospital formulary, and approval is required from pharmacy committee. The required room temperature and humidity is also maintained. As NABH now is a member of the International Society for Quality in the Healthcare, the NABH accredited Kashyap Memorial Eye Hospital, following these stringent standards, is comparable to the hospitals of international repute. Late Dr. Bharat Prasad Kashyap, who realized the grave situation of corneal blind people. He grafted 6 corneas on 1st of January 1979. To carry on the social cause, both Dr. Bharti Kashyap and Dr. Birendra Prasad Kashyap formed Kashyap Memorial Eye Bank and Charitable Trust in the year 1991. It later got associated with Eye Bank Association of India. It was the very first like member from the whole eastern region. With the first locally retrieved pair of eyes in the year 1995, the Eye Bank so far has 196 eye donations to its credit, with actual corneal grafting of 165 eyes. To promote people donating their eyes for the noble human cause, the Trust regularly organizes several programs. Netradan Mahadan is one to name with. The total eye donation pledge cards received so far are 3,505. The Trust, in association with different organizations, holds blind relief camps in different remote areas. In Jharkhand, Kashyap Memorial Eye Bank has pioneered yet another socially obligatory move: the base hospital phaco cataract surgery eye camps. In the battle against blindness, Kashyap Memorial Eye Bank and Charitable Trust has also taken care of 4 lakh school children in eye checkup and treatment with Jharkhand Education Project. The Trust did a survey and found that 82% visually handicapped kids were suffering from refractive error, 6.5% from retinal problems, 3% from cataract, 4% from amblyopia, 1.7% from squint, 3.3% had congenital less developed eyes, and 3% had corneal blindness. The school screening project was done in 2 phases. Vitamin A deficiency and common eye problems are treated in the first phase in the school premises itself, and visually weak children are brought to the base hospital in the second phase for refraction and retina checkup. 1,000 school kids were given spectacles free of cost. The trust in association with IAS Wives Association Jharkhand has also treated 20 poor patients suffering from diabetic retinopathy. The hospital provides education facilities from nurses and paramedical to ophthalmologists. It runs diploma course in optometry with Federation of Ophthalmic and Research and Education Center and degree course in optometry with IGNOU. It also offers fellowship in cataract and retina super specialty for ophthalmologists. No wonders, today patients in the eastern part of the country are no more dependent on any other hospital located far off from here, as they have within their reach a rather better option, Kashyap Memorial Eye Hospital, the only eye care institute known for the quality treatment.